This is the first session that describes the pulmonary function tests. The learning objectives are to list the pulmonary function test, define pulmonary ventilation, define lung volumes and capacities, then describe the static lung volumes and capacities, explain the importance and the significance of the different lung volumes and capacities, and then explain the clinical importance of assessing lung volumes and capacities. Pulmonary function tests are done to examine the working ability and the physical fitness of the person. They evaluate one or more major aspects of the respiratory system, such as the lung volumes, the airway function, the gas exchange. By doing this, we are testing the efficiency of the respiratory system to move air in and out of the lung. They include the pulmonary ventilation tests, static lung volumes and capacities, dynamic lung volumes and capacities, assessment of the regional ventilation perfusion ratio, blood gases and gas exchange tests, the cardiopulmonary exercise tests, metabolic measurements, and finally the chemical analysis of the exhaled breath. What are the indications for the pulmonary function test? It could be done to detect a disease, evaluate the extent and monitor the course of the disease, and evaluate the treatment. In today's session, we'll be discussing the static lung volumes and capacities. To start with, let's define pulmonary ventilation. Ventilation is defined as the exchange of air between the atmosphere and the alveoli, where the air moves by bulk flow from the region of high pressure to the region of low pressure. Normally, the volume of the air entering the lung during a single inspiration is approximately equal to the volume leaving on the subsequent expiration. Certain pathological conditions affect the volume of the air contained in the lung or the rate of the airflow into or out of the lung. In order to gain information concerning the pulmonary function, the lung volumes, the lung capacities, and the airflow rates are measured. Lung volumes can be measured using a technique called spirometry. The device used during spirometry is called spirometer. You can see here a picture of a modern spirometer. Now, we'll describe the principle of the spirometry. A spirometer is a simple volume recorder consisting of a drum, air chamber, inverted over a chamber of water. The drum is counterbalanced by a weight and is attached to a pen that writes on a paper attached to a rotating drum. In the chamber is a breathing gas, usually air or oxygen. A tube connects the mouth with the gas chamber. When the person breathes into the tube, air enters the chamber from the lungs and the drum rises and the pen is lowered. Thus, a downward bend deflection represents expiration, and an upward bend deflection represents inspiration. The recording is known as spirogram, which measures the volume of air moved in and out of the lung. Note that lung volumes and capacities are divided into two categories: static lung volumes and capacities and dynamic lung volumes and capacities. In the static lung volumes and capacities, these are untimed measurement. They only measure the volume of air moved in and out of the lungs. While the dynamic lung volumes and capacities, these are timed measurement, so these are the volumes and capacities that are measured against time. Static lung volumes and capacities. These are untimed measurement. They measure the volume of air that moved in and out of the lungs. We have 4 static lung volumes. 3 of them can be assessed by the spirometry. And we have 4 static lung capacities. What's the difference between lung volume and lung capacity? The capacity is the sum of 2 or more lung volumes. The first static lung volume is the tidal volume, which is the volume of air that moves into and out of the lung during a single unforced breath. And how much is it? The average of the tidal volume is 500 milli in a normal adult male. Where can you find it on the spirogram? The tidal volume is this. The second static lung volume is the inspiratory reserve volume. It's the maximum volume of air that can be inspired from the end of a normal inspiration. And how much is it? The average of the inspiratory reserve volume is 3000 milliliter in a normal adult male. That's to say 3 liters. And where can you find it on the spirogram? The inspiratory reserve volume is this. The third static lung volume is the expiratory reserve volume. It's the maximum volume of air that can be expired from the end of a normal expiration. And how much is it? The average expiratory reserve volume is 1100 milliliter in a normal adult male. And where can you find it on the spirogram? The expiratory reserve volume is this. Note that the expiratory reserve volume decreases in lung diseases associated with difficult expiration, as in asthma and emphysema. It's important to know that even following a maximum expiration, some air is left in the lung and the airways because the negative intrapleural pressure prevents complete collapse of the lung. This will give us the fourth static lung volume, which is the residual volume. The residual volume is the volume of air remaining in the lung after a maximum expiration. And how much is it? Its average is 1200 milli in a normal adult male. And where can you find it on the spirogram? The residual volume is this. The residual volume can be expelled out of the lung only after their collapse. That's to say, after opening the chest. So it cannot be detected by the spirometry, and it can be calculated by the helium dilution method. And then you get the residual volume by the equation that say functional residual capacity minus expiratory reserve volume give us the residual volume. Now we should ask ourselves an important question. What is the importance of the residual volume? Well, the residual volume provides air for the gas exchange with the blood in between the breaths. It prevents marked changes in the partial pressure of oxygen and carbon dioxide, so their concentration won't be changed much. The percentage of the residual volume to the total lung capacity is around 30%. If it is increased, it means obstructive lung disease. As in chronic asthma, this percentage may reach up to 70%. Or in emphysema, as there is difficult expiration, it will be accompanied by increase in the residual volume. So the ratio of the residual volume to the total lung capacity will be increased. Although we said that the residual volume can be expelled out of the lung when the chest is open and the lung collapse, yet it's important to know also that even after opening the chest, about 150 milli of the air still remain in the lungs, and this is called the minimal air or the minimal volume, and it is used medico-legally in detecting whether a newly born dead baby had died before or after delivery. This is known by placing a piece of baby's lung in the water. If it floats, it indicates the presence of minimal air. That's to say, the baby was born alive and he took a breath, then he died. On the other hand, if the piece of lung sinks, it indicates the absence of the minimal air. That's to say, he was born dead and had never took a breath. Now we'll discuss lung capacities. Lung capacities are the sums of two or more of the lung volumes. There are four lung capacities. The first one is the inspiratory capacity. It's the maximum volume of air that can be inspired at the end of a resting expiration. So, it's the sum of the tidal volume and the inspiratory reserve volume. And how much is it? It's approximately 3,500 milliliter of air. And where can you find this in the spirogram? The inspiratory capacity is this. The second lung capacity is the functional residual capacity. It's the volume of air remaining in the lung at the end of a tidal expiration. So it equals to the expiratory reserve volume and the residual volume. And how much is it? It's approximately 2,300 milli of air. The functional residual capacity is the volume of air in the lungs between breath when the respiratory muscles are relaxed. And where can you find it on the spirogram? The functional residual capacity is this. The third lung capacity is the vital capacity. It's the maximum volume of air that can be expired following a maximum inspiration. So, it's the sum of the tidal volume, the inspiratory reserve volume, and the expiratory reserve volume. And how much is it? It's approximately 6,400 milli of air. And where can you find it on the spirogram? The vital capacity is this. What is the importance of the vital capacity? The vital capacity is frequently measured clinically as an index of pulmonary function. It gives useful information about the strength of the respiratory muscle and other aspects of the pulmonary function. Vital capacity is a measure of the physical fitness as it determines the ability of the person to perform hard work that needs increased work of both the respiratory and the cardiovascular systems. So a normal vital capacity enables the person to perform muscular exercise. The vital capacity can be changed in certain situations. Physiologically, there is high vital capacity in male and in athletes due to the increased muscle bulk in comparison to the female. Also, there is high vital capacity in the standing position. Physiological decrease of the vital capacity is seen in the female. It's 20 to 25% less than the male due to the decreased muscle bulk. Also, it is less in late pregnancy due to the limitation of the diaphragmatic movement by the enlarged uterus. Also, it is less if it is recorded in the recumbent position. Certain pathological conditions that decreases the vital capacity include the chest wall disease, myositis, muscle paralysis, rib fracture, kyphosis. If there is a lung disease such as obstructive lung disease, bronchial asthma, or restrictive lung disease such as the pneumonia and fibrosis. If there is increase in the blood volume of the lung, that's to say pulmonary congestion, seen in left side heart failure. If there is intra-abdominal mass such as the ascites or the tumor, because this will interfere with the free descent of the diaphragm. The fourth static lung capacity is the total lung capacity. It's the volume of air in the lung at the end of a maximum inspiration. So it includes all the lung volumes. It's the sum of the tidal volume, inspiratory reserve volume, expiratory reserve volume, and the residual volume. That's to say, the total lung capacity is the vital capacity and the residual volume. And how much is it? The total lung capacity is approximately 5,800 milliliter of air. And where can you find the total lung capacity in the spirogram? The total lung capacity is this. Note that the total lung capacity decreases in cases of restrictive lung disease and increases in obstructive lung disease. Remember that we have 4 static lung volumes, 3 of them measured by the spirometry, while the residual volume is assessed by the helium dilution method. And we have 4 static lung capacities. The lung capacity is the sum of 2 or more lung volumes. Any lung capacity that contain the residual volume has to be assessed by the helium dilution method, and then we apply the equation to determine the lung capacity that is needed to be measured. So, the functional residual capacity and the total lung capacity contain the residual volume in their equation. That's why the residual volume has to be determined by the helium dilution method before assessing the functional residual capacity and the total lung capacity. Also note that all the volumes and capacities are less in the female in comparison to the male by 20 to 25%. Also, all the volumes and capacity are less in the recumbent position in comparison to the erect position. That's because in the recumbent position, the abdominal viscera will prevent the free descent of the diaphragm. What is the clinical application of today's session? The clinical application of today's session is the medico-legal importance of the minimal air. The minimal air is a very small volume of air, about 150 milliliter of air, that remains in the lung even after opening the chest wall and the collapse of the lung. It has a medico-legal importance as it indicates that an infant was born alive and has taken his first breath if a piece of lung tissue is placed in the water and it floats. While in case that the infant was born dead, that's to say stillbirth, the lung tissue sinks in water. By this, we finished the first session that described the pulmonary function test. Hope that you enjoyed it. Thank you.